So you've gone to your doctor, you've gotten your blood tests, and you get a creatinine level. Okay, so what does that mean? Well, creatinine is a reflection of your muscle mass, and it's a reflection of how well your kidneys are clearing out waste products. But a creatinine level of 1.2, say, means something completely different in a 20-year-old football player who's got significant muscle mass versus an 80-year-old woman who's maybe 90 pounds soaking wet. So the creatinine level really doesn't give us the complete picture. We have these formulas known as the glomerular filtration rate, which give us an estimation of kidney function. So taking into account your age, your body size, whether you're male or female, we can take that creatinine level that you get on a blood test and convert it to something called a GFR. We use that GFR number to give us a rough sense of your kidney function. We take that GFR number and then give you a stage of your kidney disease. There are 5 stages of chronic kidney disease. Stage 1 is when your kidney function, your filtration, you're filtering out your waste products normally, but you may have some early signs of kidney damage, such as some protein in the urine, some albumin in the urine, that can commonly go along with someone who has heart disease or diabetes, or you may have some blood in the urine or some changes on some x-ray studies that go along with more genetic causes of kidney disease. Stage 2 is when you start to have some changes in how you're filtering out the waste products. The GFR is somewhere between 60 and 90, and you can either have some protein in the urine or some blood in the urine or some other features. When your GFR is at that level, between 60 to 90, or you're at stage 2 chronic kidney disease, that's really when we need to start being very aggressive about managing risk factors of kidney disease, such as high blood pressure, high cholesterol, diabetes, and weight loss. The good side is that when you work on those risk factors, you can have the greatest impact. Stage 3 is when GFR is somewhere between 30 and 60. That's the point that gives your primary care physician the signal to say you need to start seeing a kidney doctor. This is also the point at which individuals start showing different side effects of having their kidney disease. They can start having anemia from their kidney disease. They can start having bone disease. They can also start having a little more problem with high blood pressure management. And so it's a good point to have a referral to a kidney doctor and start that discussion about the progression of kidney disease. Risk factor management also impacts significantly. We can do a lot with slowing down the rate of progression in that stage. Stage 4 is when a GFR is between 15 and 30 mLs per minute. At that point, that's when I call it sort of the renal replacement planning counseling period of time. Risk factor management is still important in terms of your blood pressure control, your diabetes control, and your protein control, but it isn't going to prevent any further development of your kidney disease. It'll help slow down the progression, but it's sort of inevitable that you're going to have worsening kidney function. And so this is the point where we want to start the discussions about, would you opt for dialysis? What type of dialysis modality would be the best bet for you? If you are someone who is leaning towards hemodialysis, often this is the time when we send you to the surgeon for planning of an AV access or an AV fistula in preparation for your future dialysis needs. Or we'll send you to a surgeon to be evaluated whether or not you would be a good peritoneal dialysis candidate. This is also the point where we start the referral process for transplantation, because the goal would be, if possible, to undergo a preemptive transplantation or a transplant before you need a dialysis. So this might be the point where you start the transplant evaluation, you start the screening process. If you have any potential live donors, this is the point at which they would also be screened. Stage 5 is when you have a GFR below 15. This is about the point where we start people on dialysis therapy depending on their symptoms. While we start looking at people to start dialysis once their GFR is below 15, there's no specific number that tells us that someone needs dialysis. It's really dependent on what your symptoms are and whether or not you are getting into more trouble from not being able to have your kidneys clear out most of the waste products. We look for symptoms of malnutrition. We look at whether or not you're losing weight. We look at whether or not you're having a lot of problems with nausea or vomiting. We look at problems of whether or not you're responding to medications that we've given you in the past for your bone disease, such as vitamin D, or medications that we give you for your anemia, such as Procrit shots or Aranesp shots. We also look at your energy level. Some people, the only symptom that they'll get from their kidney disease progressing to the point where they need to start dialysis is fatigue. Your body will be the best way for us to tell whether or not you're ready to start dialysis or not. While these numbers give us a guideline and help your physicians that are taking care of you decide when to start screening you for different conditions and how to manage different risk factors of kidney disease, they're rough guidelines. Your bodies and your symptoms are probably going to be the most important driving factor.
iCompassion.org, a registered 501c3 nonprofit, is the first free, independent, and trusted online community for people dealing with kidney disease. iCompassion.org allows people to quickly find information regarding kidney disease and treatment options, and to become a part of an online community to get connected, get better, share hope, and give back. Join today and share your story of hope.